If you're diabetic and stumble across this video, this might be one of the things that you're concerned about with your feet. It seems like no matter how hard you're trying to moisturize your feet, you can't get on top of the dryness that you're experiencing. Your skin might be itchy as well. You might be dealing with calluses. This was a comment that was left under one of my previous videos. Thank you to this commenter here. And they asked, and I have my laptop here, thanks, but can you please explain what causes itchy and scaly feet? I'm a diabetic and currently experiencing that. My name is Dr. Tarr. I'm a board-certified podiatrist in private practice here in Phoenix, Arizona, and I own a small practice called Direct Podiatry Arizona. I'll be going over today the reasons why your feet are dry, itchy, and scaly as a diabetic. So if you would like to learn more, stay tuned. If you've come across my other videos on how diabetes impacts your feet, from the circulation problems to increased risk of ulcers and even amputation, diabetes does a number on your feet, or can potentially. So one of the ways that diabetes does impact your feet is that it changes your skin. Diabetes also can cause nerve damage, neuropathy, numbness, tingling, burning. And this is because the high blood sugars in diabetes actually attacks the nerves, especially the nerves of your feet, and that can cause changes in feeling. But diabetes also does attack the nerves that are responsible for sending signals or messages to the sweat glands and to the oil glands at your feet. And this is known as autonomic neuropathy. So because these nerves are now damaged by the high blood sugars and diabetes, it's a lot harder for your oil and sweat glands in your feet to receive the messages that they should, to release oil, to release sweat, to hydrate your skin. And this is one reason why diabetic feet can be so dry. Diabetic neuropathy can lead to very, very, very dry, dehydrated skin on your feet. Diabetic neuropathy can also lead to changes in your foot shape over time. And trusty foot model here, your foot was designed to take pressure in certain areas more than others. When your foot starts to change shape, maybe your arch becomes higher, for example, or your arch completely collapses or drops. You can deal with different things going on with your joints and your toes and in the ball of your foot that can lead to dislocations, that can lead to hammer toes, bunions. Now, all of a sudden, your foot isn't able to receive pressure when you're walking, standing in the way that it once would in a healthy foot. How you start taking more pressure, that can lead to calluses. And calluses in a healthy person are usually a very normal thing, a very benign thing. They don't cause any problems, maybe a little bit of discomfort. But other than that, if you're someone that is not diabetic, you don't have neuropathy, you don't have poor circulation, it can be something that you just manage and it's fine. But in a diabetic, calluses are cause for concern because it's a signal, a sign that wherever the callus is, you're getting too much pressure in that area. And those can be places where eventually you can develop, or you're at higher risk to develop, an ulcer, which is a chronic sore or hole in your foot. And if you're unable to heal that sore, to heal that wound, that can lead to infection, hospitalization, and amputation. The second reason why diabetics tend to have issues with dry, scaly, itchy skin is just because with diabetes as well, it makes it a lot harder for your body to hold on to water, and especially your feet to hold on to moisture. It makes it a lot harder to stay hydrated. Being diabetic can increase the amount of water that you're losing through urination, and your skin, because of that, can become less moisturized and become dry, become scaly. The third reason why you're diabetic and you're dealing with dry, scaly skin is possibly because of poor circulation. So poor circulation is unfortunately one of the things that we see as foot doctors or podiatrists commonly in diabetics. And that is because diabetes can do damage on your arteries that are responsible for bringing blood from your heart to your feet and legs. It can cause these blood vessels to become very hard, to have plaque buildup inside them. And when these things happen, less and less blood flow will reach your legs and feet. Blood is a carrier for nutrition, for vitamins, for minerals, for antioxidants. So if your feet and legs aren't receiving blood that they need, they aren't receiving the level of good nutrition, which can lead to poor skin quality, can lead to dry, flaky, scaly skin. So again, this is something to be mindful of if you have diabetes, if you have circulation issues without being diabetic, just because these type of skin issues, again, can increase your risk of ulcers, of chronic wounds, and that can increase your risk of, unfortunately, hospitalization and amputation. So how to manage dry, flaky, scaly skin in a diabetic foot. One, if you're diabetic and you're dealing with these type of skin issues in your feet, you really should have a podiatrist that you're seeing regularly. And how regularly you'll see that podiatrist or foot doctor depends on what you have going on top of your diabetes. If you're just diabetic with no other issues, you're not having neuropathy, you're not having circulation issues, then once a year is fine to just do a quick checkup with your podiatrist just to be sure your feet aren't undergoing any changes that could potentially cause problems with ulcers down the road. If you're having issues with neuropathy, changes in sensation, if you're having circulation issues, then you'll have to see your podiatrist more often. And then at that point, we can talk to you about certain prescription lotions to help manage the dryness and help ultimately decrease your risk of developing an ulcer. There's a couple different ways that this can be done. One is something called lachydrin or ammonium lactate generic. Again, all of these are lotions that you would apply on your feet. A lachydrin is really good for super dehydrated skin. Again, the feet of diabetics typically, and that will help impart more moisture into your skin from the outside in. Prescription strength urea is another one that I commonly prescribe, especially to people that have very thick calluses, a lot of buildup of dead skin, especially on their soles or their feet. I'm a fan of urea, usually 40%. And urea is a gentle acid that will eat away at that callous, very dry skin until you're left with skin that is more hydrated and more supple. Now, if you're going in a grocery store to buy lotions and you want to start out with this first, that's totally fine to do. You definitely want to make sure that the bottle says for diabetics. And this is what I tell all my patients. Just because, again, as you've hopefully learned today, diabetic skin tends to be a lot drier than normal skin. A lot of times, unfortunately, normal lotions aren't going to work as well for diabetic feet as diabetic lotions will. Diabetic lotions have a lot more emollients and hydrating properties. They're usually a lot thicker as well. And they usually do have some form of ammonium lactate or urea in the ingredients list, not to the higher dosages that can be prescribed, but it does have some form of either ingredient. Natural sources of moisturization for your skin, things like shea butter and coconut oil are great for diabetic skin. Shea butter, if you're not familiar with it, comes from the shea nut. Shea butter is something I grew up using. Being Liberian, we use it for a lot of different uses, but it is actually really good for diabetic skin. Shea butter can make almost like a protective seal over the skin that prevents any added water loss. Shea butter contains fats that can help restore the skin. Shea butter contains vitamin E, vitamin A, which can have some anti-inflammatory properties. It's gentle, non-irritating, and great for diabetic skin. Shea butter is commonly grown around West Africa. So usually how I tell my diabetic patients to moisturize their feet, regardless of what source of moisture that they choose or which product that they choose. After you bathe and your skin is damp, that's when you want to lock in the moisture with something like a shea butter or over-the-counter lotion, because that will lock in any type of water that you have in your skin, on your skin, and that will make it a lot harder for that water loss to happen, for that water to evaporate from on and within your skin, keeping your skin well hydrated for a lot longer. Itchiness sometimes can be a symptom of dryness. Sometimes the itchiness can come from other things like athlete's foot, unfortunately. So if your itchiness isn't getting better with better hydration of your skin and better moisturization of your skin, definitely see a local foot doctor, because that can be a sign or symptom of something else going on. This is my top 3 reasons that your diabetic feet are itchy, dry, and scaly. So leave me comments in the comment section down below. Are you diabetic? Have you been dealing with very dry, itchy, scaly skin? What has helped? What hasn't? What lotions do you like to use? What other natural products do you like to use as well? If you like this video today, like and subscribe. Be sure to hit the notification bell so that you receive a notification from me whenever I post my next video. And I will leave a link in the description to my blog post talking about this topic, reasons why your diabetic feet are dry. Also, I will leave a link to my email newsletter. Feel free to subscribe to receive weekly content from me. And until next time, take care everyone and wishing you good health. Bye.